Research has shown that about 70 to 80% of breast cancer are hormone induced. Hi guys, welcome to my YouTube channel. Today we are going to discuss a very important question, and the question is, does breastfeeding help to reduce the risk of a woman having breast cancer? Alright, before I answer this question, I would like us to know what breastfeeding is. Breastfeeding is just a natural way that God created that women used to feed their young ones, their newborns. So it's natural that a woman that just gave birth breastfeeds her child. In my previous video, I discussed the importance of breastfeeding to the baby and to the mother. So you would like to watch this video, click on this topic. That's the topic for the video. Just so you can see, so that you know that the breastfeeding is very important. The importance of this breastfeeding cannot be overemphasized. Back to our main topic. Does breastfeeding help to reduce the risk of women having breast cancer? The answer is yes. Why does it occur? Is it just because of the baby is suckling the breast, or is there something deeper that occurs? In this video, we are going to discuss everything that helps during breastfeeding to reduce the risk of women having breast cancer during breastfeeding. One of the things that helps to reduce the human risk of having breast cancer is what we call hormonal suppression. You know, during breastfeeding, there is a hormone that is released. We call it prolactin. This hormone is the hormone that is responsible for the production of breast milk. So during breastfeeding, this hormone tends to be in high amounts in the body, and presence of this hormone, and when this hormone is in high amounts in the body, it tends to reduce process of ovulation or menstruation, and this thing can reduce or even stop production of estrogen. Estrogen is produced in the ovary. So when ovulation is stopped or reduced, this production of estrogen is reduced. In my previous video, I explained some of the importance of breastfeeding, and one of them is that it helps to provide natural birth control. So when this prolactin level is high, it tends to make the woman not to ovulate within that period, and no ovulation means no fertilization. Alright, so you see, you need to go and watch that video. Alright, okay, so in this case where the prolactin is high and the estrogen is low, this is one of the things that helps to reduce the risk of breast cancer, because hormone we call estrogen, it helps to fuel some growth of breast cancer. How does estrogen fuel the growth of some breast cancer? Alright, research has shown that about 70 to 80% of breast cancer are hormone induced, and some of the hormones that induce it, one of them primarily is this estrogen. So these some of these breast cancer, the cells are hormonal receptor positive. So mainly the primary hormone that have this effect is estrogen. So some of the breast cancer is estrogen receptor positive. That's how estrogen helps to fuel the development of breast cancer, because this estrogen to bind and help in the multiplication and the enlargement of the breast cancer. Alright, I'll explain this for your own understanding. Alright, so I'll use this scenario. There is a male going to a house, delivering a message to a house, and that house has a male slot through which that male, if he reaches the house, that male will enter inside the house. Alright, so this male now is the estrogen, the male slot is the receptor, alright, and the house is the cancerous cells. Alright, okay, so the estrogen that is now male is released, and this estrogen, it will travel through blood. Maybe the male travel through sheep, travel through blood, or through air, whatever. Alright, I just want you to understand this. So when this male reaches the point where the house is, they'll have to enter through the house through the male slot. Alright, that's the place that is designed for the male to enter. Alright, so when this male, which is then estrogen, reaches to that point where the house is, it will enter inside the house through that slot that is open, the male slot. Alright, so this male slot is now the receptor. So all the houses, for example, the houses are the cells in the breast. So now the houses that have that male slot, that's houses that have the estrogen positive receptor are the cancerous cells. So when this estrogen now enters through the bind to the house, okay, that's when the male have entered inside the house. The male will deliver a message to that house. The message that the estrogen will send is the message for the cancer cell to start dividing, to start multiplying. So that's how the cancer develops in the presence of estrogen. So you see what I explained before. When prolactin level is high, that estrogen that will send that message will be low or will even stop, or the body will even stop producing it at that moment. That's how breastfeeding helps to reduce the risk of breast cancer. You see, this kind of breast cancer, the doctors, they treat it through one, giving the patient drug that will block estrogen from binding to the estrogen receptor cells. It's like stopping the male from entering the male slot. Or number two, another way they can treat this kind of thing is by giving the patient drug that will prevent the male from being released. Okay, when there is no male, there's no message to deliver. So doctors will tend to give patient drug that will prevent or reduce the production of estrogen, thereby managing the condition of the patient. So you see how the process of breastfeeding can reduce a woman's risk of having breast cancer. Alright, so if this video is helpful, please like, share, comment, and very important, subscribe on my channel, as we are going to be bringing more educative and helpful videos for you. So in my next video, we are going to talk about adult men suckling women's breasts, whether it helps to reduce breast cancer. So what do you think? You would not like to miss that. So subscribe on my channel and follow me for more videos. Thank you. God bless you. See you in our next video.